This week for my students, we're going over the urinary system. And so as is the case every week, we kind of like to start with the gross anatomy and then we'll zoom in. So we start with a big picture and then we zoom in. We even get into a little bit of histology. And then we, always try to wrap things up with some big picture concepts or talk about some clinical applications we have. So let me start off by holding up this model here. Here we have the urinary system. And so the things that happen on live YouTube television, we're losing kidneys here, people. Okay, so here's the urinary system. You can see that we have the kidneys. Always remember your rights and lefts. So this would be the right, this is the left, because this is a coronal view, an anterior view. So you're facing the person. And then we have these tubes that will connect the kidneys to the urinary bladder, which is right here. So these tubes are called ureters. And we have a right and a left. They transport urine into the urinary bladder. And then we'll talk about urine's grand exodus as we focus in on the bladder itself. So those are the basic things that we want to start off with. Other landmarks that are important for you to know is that we have this indention here, which is on the medial side of the kidney, meaning the innermost side of the kidney. And that is the renal hilus, or you may also see the word hilum. And the hilum is just this indentation. That's what gives the kidney that bean shape. And that's a nice landmark to know because that helps us see where the ureter and the blood vessels enter and exit the kidney. If I were to hold this like such, we can start looking at some inner portions of the kidney. So now that we have this open, there's some internal kidney features that you need to know. I do have a few videos on my channel that kind of break this down. I actually use a kidney model next to a pig kidney so that you could see the nice, very color-coded version next to an actual specimen that is triple injected, meaning we have the blood vessels injected with a dye. But even with that dyed, you can see, oh wow, that's kind of hard to see. So I do have a video that has those side by side, and I go through all these structures on that video in case you're like, hey, can you slow down or stop so I can learn that part again. And then I have another video that zooms in on a structure called the juxtaglomerular apparatus, which is very important. That's more so important to lecture concepts that you guys will see in your when you're talking about the physiology of the urinary system. But that is there as well, just in case I'm going through and you're like, wait, please stop. So the thing I always like to start off with the kidney is by saying there are geographical regions that we want to make sure we understand. So this outer portion, so if I'm holding it like this, I want to show you that this is going to be the medial side and this is the lateral side, meaning the way I'm holding this, we're looking at the left kidney. Okay, so medial being, again, closest to the midline, that hilum, and the fact that these are coming on this side, that tells us that's medial, lateral. We can look at this outer portion up here. It's this, this dark area over here. This is called the renal cortex. And then if we go deeper in, okay, so we're moving inwards, then we have the renal medulla. And actually, let me hold up this model right here to help show that, because I think this one, I might need to maybe have this set up for our session next week so I'm not having to shuffle things around. But here you can see we have that nice renal cortex, and then this right here is going to be the renal medulla, or you'll hear medulla as well. These structures right here, they look like triangles or like pyramids, and we call those renal pyramids. So As is always the case, it's really nice that in A&P, a lot of our terms are named because of what they look like. And so that's really nice for you guys when you're having to learn all this. So when you see these individual pyramidal structures right here, those are the renal pyramids. At the tip of each pyramid, so if we were to look at, let me hold, like this one right here specifically, okay, the tip of the pyramid kind of looks like a volcano from here. Okay, that tip is called the renal papilla. Okay, so that is the renal papilla. It is just the tip. When we talk about where urine comes from, we will see that term again. In between each renal pyramid is an area called a renal column, and it literally just looks like a column in between. So if you've heard of the term renal lobe, a renal lobe is made up of a renal pyramid and then the two portions of the renal columns that are on either side. So it kind of makes the renal lobes make up these pie slices, and we have anywhere between 8 and 15 of those per kidney here. Let's see. Okay, so then as we're going in, we have, so inwards again, we have this area right here called the renal sinus, and the renal sinus has other structures inside of it. So just know that if we were to kind of pull this stuff out, this part right here is what is referred to as the sinus. The way I like to teach the kidney is kind of going through blood flow and then what is ultimately called urine formation. And it's kind of cool to think about that because urine is created from blood plasma. So really, if we didn't have blood in our bodies, then we wouldn't be able to have urine. So I'm going to start off by going over the blood supply. The way I like to teach this is in what's called a trace format, meaning we kind of start one place and we literally just trace the pathway through the model, the specimen, whatever I have here. And that kind of helps us learn the order of these structures here. So let me get this model again, and I'll be switching to other models as we kind of get into more detail because it's easier to see that. So here, this is the renal artery. Okay, we know it's an artery, not necessarily because it's red. It is red, and we do find that in the systemic system that arteries, systemic vessels are red, but I try to get my students not to remember the whole red-blue thing. But the red one is the renal artery. And then as we go in, we have the segmental arteries. So they will break up into segments of the kidney, and that's a nice way to think about that. And then we have interlobar arteries. Okay, the interlobar arteries go in between the lobe because inter means in between, lobar refers to lobe. And so remember when I was saying, like this is a lobe right here, it makes sense then that the vessels in that area would be interlobar. Those will then go into, okay, so if we're just following the blood going this way, you'll notice that this blood vessel is tracing the shape of that renal pyramid. It makes an arc shaped. So then when you guys are looking at your lab manual, you can see you have this term called the arcuate artery. So I like to get real hands-on and say arcuate artery looks like an arc, and it's going to trace the shape of the renal pyramid here. That's also another good landmark because we have this area called the corticomedullary junction, meaning it is the kind of the border between the cortex and the medulla here. Okay, from there, now we go into these smaller vessels. Okay, so we started here, renal artery, segmental, interlobar artery, arcuate artery, and now we're going into the cortex. So an older term we've learned before was interlobular artery, and I think that's in your lab manual. But a name that I like to teach is called the cortical radiate artery. again, in AP, I know we have lots of big terms here, but I think it's good to kind of slow it down and break it up and to really think about what visual image you get in your head when you look at the term. So cortical, that's the cortex. Radiate, so what do you think? Something's radiating, right? So when it radiates, it's going to kind of go out like this. So therefore, it makes sense that these would be the cortical radiate arteries. Once we zoom in even farther, so let me get this model again. It's always good to remember we're zooming in every time. So here we have the gross anatomy, and what we've done here is we are zooming in to a specific section. So what part of the kidney do you think this is? And at any time, if you guys are chatting, I recommend go ahead and submit your answers. You can participate that way on the chat bar there. Or at home, just say it out loud. So if this is the outer area, that would be the renal cortex. So we're just kind of zooming in right here, which means this part, which is more inwards, that is going to be the renal medulla. So you can see this vessel right here is part of the interlobar artery. This one that makes that arc shape, that's the arcuate artery. And now these vessels, which are radiating into the cortex, are those cortical radiate arteries. You can see here that they are going to connect to these pale structures here. And these are the structural units of the kidney. These are these little tiny things that are responsible for making our urine. So when I zoom in a little bit more, okay, here we have a cortical radiate artery. You can see that we'll have little branches off of that. And each one of those branches will go to one of these ball-like structures. Okay, we will return to that in just a moment, but I want to finish with the blood flow, and then we are going to come back to this. This part right here is like the total VIP of the kidney, because this is where we have two things combining, where blood meets filtration, or filtrate as we say, which eventually becomes urine. All right, so we can see here, we'll just follow it this way. We have a vessel that's going to come out. So this afferent arterial, which is what that's called, goes into this ball-like structure called the glomerulus. Again, I am going to zoom into this and repeat those terms here. On this right here, so we're zoomed into one of these ball-like structures. This is the afferent arterial. Now, in actuality, these terms are pronounced afferent and efferent. But how many of you would be saying, which one did she say? When I'm just going, blah, 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 afferent, efferent. They sound very similar. So I like to purposefully mispronounce the terms and really emphasize the first letter of the word so that you know exactly what I'm saying. And there's also a memory trick to that. So off of this cortical radiate artery, we are going into the ball-like structure, which is called the renal corpuscle. And it connects, so right here is your afferent arterial going into this structure here. This ball of capillaries is called the glomerulus. Okay, and when I say capillaries, I know we often think, oh, capillaries are where gas exchange occurs. But remember that capillaries actually just describe teeny tiny vessels. So here we don't have gas exchange, but we do have something else very important that is happening here, which again, I will come back to that when we start talking about where urine comes from. So here, this afferent arterial goes into the glomerulus, and then it will exit through the efferent arterial. So the other reason why I kind of mispronounce those words is because these two are easy to mix up. The afferent or afferent is the thicker vessel going into the glomerulus, and the efferent or efferent arterial is E for exiting the glomerulus. So I think efferent, exiting the glomerulus. That efferent or efferent arteriole, here is an example of one right here. That is going to then go to a set of capillary beds that we do have in within the cortex and surrounding, which this doesn't show, but I have another thing that will another model that will show that, into the actual capillary beds. So then if we were to follow these capillary beds right here, now we are taking the blood back towards the heart. So arteries, no matter what color they actually are, arteries carry blood A4 away from the heart, and it delivers it to the tissues and or organs, wherever it's going in the body. Veins, therefore, take blood from those places, and they will bring the blood back to the heart. So now that we are on our way, we're basically doing a U-turn within the cortex, and now we're just going to go right back out the way we came via different vessels. So here we have that capillary bed. What are these smaller vessels called? Those are the interlobular or cortical radiate veins. Okay, so these are the veins right here. Because we're going back to the heart, we're going in reverse. Now we're going to go back towards these. What are the vessels that are arc-shaped? Those are the arcuate vessels. And so since we're going back towards the heart, we would say that's the arcuate vein. Okay, those arcuate veins. So kind of looking over here, cortical radiate vein or interlobular vein is the older school term we've used. That's going to go to this arcuate vein here. Then that goes to the interlobar vein. The vein which is in between the lobes is a way that you can remember that. And then that simply is going to join back up to the renal vein. We don't have segmental veins in the kidney. And then, as my students know, we've looked at blood flow in several different chapters. That renal vein is going to make its way back to the inferior vena cava, and then that's how that blood gets to the heart. So that is the blood supply. So let me just pause really quickly and see if there are any questions regarding the blood supply in the kidney. And Donna, I loved your answer earlier, cortex. Yeah, that was absolutely correct. So good job with that. Okay, so now what I'd like to do then is let's talk about, let's zoom back in to the cortex, and we're going to see where blood flow and urine formation meets up in the kidney. So again, just using this model very quickly, what we're doing is we are returning to the cortex, and within the cortex, so I'll use this model right here. Within the cortex, so again, this always take a second just to refamiliarize yourself when you're looking at a new study aid. So here's the cortex, here's the medulla. Within the cortex, we have these little structures here called nephrons. And the nephrons are the structural units of the kidney, meaning that these tiny little things, we have over 1 million of them in each kidney, which is crazy to think about, these little things are what create urine. So we're going to zoom in here and see how that is formed. And then we'll follow the structures, gross anatomy to microscopic anatomy on the other model over here. All right, so looking at this section right here, remember this represents the arcuate artery, and then we have this cortical radiate artery, okay? Off of that are these tiny little branches that are going to connect to a ball-like structure, and the afferent arteriole is going to go into that ball-like structure. Now, that ball-like structure is referred to as the renal corpuscle, okay, the renal corpuscle. The renal corpuscle is made up of a couple of different things here. So let me go to this view right here. The renal corpuscle is this whole ball-like structure here. You can see when we slice it open and look on the inside, we have this ball of capillaries right here. The ball of capillaries is called the glomerulus, which is what we saw a little bit ago. That afferent arteriole goes in to this ball of capillaries, and then the efferent, E for exits the glomerulus or the renal corpuscle, goes out there. Let me zoom in to this structure right here. So here is the renal corpuscle. It is made up of this outer layer right here. This is, in older terms, we've called this Bowman's capsule. Okay, but we're seeing it described more so these days as the glomerular capsule. And it is made up of a parietal layer and a visceral layer. So this is a review back to A&P1. You guys know I like to bridge back to A&P1, which might be annoying because you're thinking, I'm in the second semester. I don't need to know A&P1. And it's like, no, remember it builds. So what is the parietal layer? It's the outer layer. Okay, so the parietal layer of something is always the outer layer. The visceral layer is always the inner layer. So the parietal layer of Bowman's capsule, or the parietal layer of the glomerular capsule, is this right here because it's the outer one. Okay, you can see here, I like this model because it actually kind of shows it, because this is a concept that's always challenging for students to see, and it was for me even. But it kind of comes back and then it covers the glomerulus, this ball of capillaries. And that covering, which are called podocytes, and for my students, that term is not on your list, but it's still good to know. I'm sure you'll be hearing that in lecture anyway, so it's good to know that term. But we have these podocytes. They kind of have like little feet-like structures that spread over these blood vessels right here. Those podocytes are the visceral layer. So the parietal layer is on the outside, and then as soon as it comes back, it's going to go in, and now it's just going to cover these blood vessels here. That is the visceral layer. For my students, when we, in your image that looks like this, it's that light blue stuff on the bottom figure in your lab manual. In between the two layers, is the capsular space. So this space right here, that kind of makes sense, right? We see that a lot of times. So we have a space in between here. All right, so now what is this thing right here? This section is called the proximal convoluted tubule. Okay, proximal means closest to the point of reference. That's a term that we've seen since A&P1. We used it when we talk about limbs, meaning, proximal is closest to the point of attachment, distal is farther away. I introed that when we went over the digestive system, and I said, hey, I know we were kind of just saying extremities in A&P1, but we can actually use those terms in other contexts as well. So proximal, really, I want you to think of it as closest to the point of reference. So in this instance, what is our reference? The renal corpuscle. So this tube that is the closest to the renal corpuscle, that is the proximal convoluted tubule. Convoluted means twisted or coiled up. So now let me just go to this view right here. This is a really nice model. I like this. It's very handy. Here, so if we look at this ball-like structure, you can see we have all these like coiled, twisted up tubes. Those are the convoluted tubules. And what you need to know is that one of those sets of coils is the proximal end, and the other set is the distal end. So just kind of take a moment. How do you think you would be able to tell the difference between the two? Well, one coil should be closest to the point of reference. The other one would be farther away. So let's look at this. Right here with this renal corpuscle, do you see how this tube, it's yellow on this model, this tube is coming directly off of that renal corpuscle? Well, yes, that is closest to the renal corpuscle. Therefore, that yellow portion is the proximal convoluted tubule. Always remember that reference. The proximal convoluted tubule is then going to go into this loop right here. Maybe you've heard loop of Henle or nephron loop. That is what that is. Okay, so the nephron loop or loop of Henle, whatever's easier for you to remember, that's what that is. So if I were just to go to this example right here, this tube is coming directly out of that renal corpuscle. So that's the proximal convoluted tubule. You can see when we follow, it's like a little roller coaster. Maybe that could be Six Flags new ride. Maybe not. Bad joke. That would be a cool ride though. All the biology people would be like, yeah, I love the new nephron roller coaster. So here we're going to go down and this is going to be the descending limb of the nephron loop. So this whole part right here is referred to as the loop of Henle or the nephron loop, but then we can further divide it up into portions. So this part that's going downwards, that is the descending limb. And then the part that is going upwards, what do you think that is? That would be the ascending limb. Okay, so that is the ascending loop or limb of the nephron loop or ascending limb of the loop of Henle. You can see if when we follow this, now it's the color white. When we follow that, that is going to go into another mess of coils. Okay, this coil is farther away than this one is to the renal corpuscle. And maybe you're thinking, no, it isn't. It's right next to it. But if I were to take my, let's see, I've got my phone right here. Okay, so I've got my phone right here. If I were to take this end and let me coil it up real fast. Okay, now I got a convoluted tubule, right? Okay, it's right next to it. And what if I said, okay, the chart, the USB part, is that proximal or distal? You might say, well, maybe it's proximal because it's closest to the reference, which is my phone. But remember, when we're talking about things like a tube, it's not just being in close vicinity, it's the actual distance. So if I were to take this and go, okay, it doesn't even fit on my screen, right? Here's my phone and here's the end. So do you see how this is actually distal? It's the same thing that we see with those convoluted tubules. So even though, that's why I want you to, if that's kind of confusing when you're looking at your lab manual, kind of slow down and when you realize, oh man, when I keep following that pathway, that took a lot longer to get there. That means distance-wise, it's actually farther away. So that would be the distal convoluted tubule. This distal convoluted tubule is going to connect to the collecting duct right here. Okay, that's what connects to the collecting duct. Kind of looks like a big tree-like structure here. And many of those, okay, let me see, many of those will go through the renal medulla right here. And this is one reason why we have a lot of the medulla kind of looks stripy, okay? It's because you're seeing all those collecting ducts there. Hi, Chris Rollins. Maybe he didn't think I'd call him out. I will call you guys out when you're watching my channel. That's a good thing. I like your participation. By the way, if you're watching this after the live version, you will not be able to see these comments. So I will look just as crazy as I do every day in class. But when a question is submitted, this is just an FYI for those who are watching this after the fact, I will try to I'll read the question and then I'll answer it in that fashion so that you're understanding why I'm going back and forth, or maybe why I'm looking at this part of my screen a lot. It's because I'm checking for questions here. Okay, so collecting duct is going to run through the renal medulla. So let's take this model then. Ooh, my big model. Okay, do you see how these collecting ducts run through here? That's what gives these renal pyramids that stripy appearance. They are going to run to the tip of the pyramid. Do you guys remember what the tip of the pyramid is called? It is the papilla. Okay, so that's when I said earlier that the, we'll come back to that term papilla. By the way, going back to this, how does this relate to urine formation? Okay, fluid, it's going to come back to this structure right here. I'm going to zoom into this for just a moment before we connect everything over here. This, again, is the renal corpuscle with the glomerulus. We have a very important area called the juxtaglomerular apparatus, and that is a mouthful, but it's okay. You should still learn that because it's actually really important. When we're looking at that, for my students, you just need to know a couple of specific portions of it, but you won't know what those are unless you know the blood vessels and those convoluted tubules, which we talked about. So we have the granular cells, and I like to point this out to my students because it's a good way for you to look at the material. We have the granular or juxtaglomerular cells of the afferent arterial or afferent arterial. That afferent arterial, so one way you can tell the difference between the two is that the afferent arterial is always the bigger one. Okay, so when we're looking at these two right here, you can see that this one is clearly bigger than this one, so that you know that's the afferent arterial. There are specialized cells here at the opening of that arterial. Those are the granular cells or the juxtaglomerular cells. So those cells that are specifically there, it kind of makes this vessel look widened. Those are those juxtaglomerular cells. Then we have the macula densa of the distal convoluted tubule. So you have to say, okay, of the distal convoluted tubule, I need to know where that one is. Is it this one? No, it's not that one because this one is coming directly off of the renal corpuscle. So we know that that's the proximal, which means this up here is your distal convoluted tubule. How do we know that's the distal convoluted tubule? Well, remember, when things get coiled up, here you can see the proximal end is right here. Do you see how after we go through that loop of Henle, we come back up, that coil snuggles up right close to that renal corpuscle? That is the DCT, or the distal convoluted tubule. We have specialized cells right here. They're more of a columnar shape. So again, we're going back to terminology from A&P 1. And those specific cells that are right here, that are more columnar shaped and in close vicinity to that afferent arterial, those cells specifically are those the macula densa. Okay, we have other cells too. We have the extraglomerular mesangial cells. You don't have to know those, thank goodness, but those are going to be in this area. And the reason why we care about that is because when blood comes in here, plasma, okay, solutes within the plasma, we have various things. You'll talk about this a lot in lecture, but we're going to have things that will come out of this capillary. We'll have fluid and certain solute particles that come out of this into the capsular space. Okay, how do we know what can go through? Well, that is determined by these podocytes, that visceral layer of Bowman's capsule. And so when it becomes more permeable, you have the gaps open like that. And so more things could pass through. And when it becomes less permeable, those gaps kind of close up. So then things can't really come out. Those things that end up in this part right here, okay, that will be in the capsular space, and that fluid ends up going through the proximal convoluted tubule. So let me just turn my lab manual page here so I can be on track with the terms. Okay, so here we have filtrate, and then once this filtrate goes into the proximal convoluted tubule, that's what we call tubular fluid. This fluid then is going to go through this structure right here in the loop of Henle. Again, you guys are going to talk about this quite a bit in your lecture courses, but as this fluid goes through here, The medulla is a very salty and has a very salty environment. And if you also remember from A&P1, water follows salt, you're going to have different kinds of pressures that will influence things going in or out of these, out of the limbs of the nephron loop. And then imagine these blood vessels right here. I kind of wish they showed that. These are also in this area around the nephron loop. So that is how we have a transfer of things being reabsorbed to be kept in the body, so nutrients. And then waste products are secreted. So things that are reabsorbed go back into the bloodstream. Things that are secreted go into the tubes to be excreted by the kidneys through urine. So that fluid is going to come through this nephron loop. We're going to have things moving in and out. You will talk about the different tissue types. We have simple cuboidal epithelium, which is what makes up this thick segment. And then we have a thin segment, that's simple squamous epithelium. Again, a return to terminology from A&P1, and this is why we want you to know that, so you can tie all that together. So when all of that has happened, okay, that fluid is going to come back up through the ascending limb and then to that distal convoluted tubule. This is the really cool thing about this juxtaglomerular apparatus. And I made a YouTube video that talks just about this area, and I recommend you watch it because it just blows my mind. Doesn't matter how long I've been teaching this, I'm just like, how does this happen? It's just so cool. But the macula densa, okay, will basically kind of screen the fluid that's coming through here. And it will communicate via paracrine hormones to the juxtaglomerular cells how permeable these podocytes should be. Meaning that on a small scale, we can control what goes into the different types of areas of fluid we have. We can also control blood pressure, which is really amazing to think about how tiny these structures are, but what a global effect that can have on our bodies. So, oh man, I wish I could take more time to talk about that, but I won't. Watch my YouTube video on that. It's just, okay. So going back, so that's why we care. All that to say is that's why we care about this. And why do I have to learn those super big terms? Because they're really incredible. So from the DCT, that fluid, which is called tubular fluid, goes into that collecting duct. So now we're going to get to the parts where you're going to be like, okay, I'm much more familiar with these areas and I can kind of think of this a bit better. Those collecting ducts, again, are what kind of give the renal pyramids the stripy appearance. And they will dump into the renal papilla. Remember, the renal papilla are just the tips of the pyramids. And those pyramids, or excuse me, the papilla will open up to this kind of, see how it kind of looks like a cup or like a goblet? That is called the minor calyx. Okay, calyx is singular, calyces is plural. And let me pause here. Okay, Michelle, awesome question. So Michelle said, what is the name of the fluid that enters the proximal convoluted tubule? So that's a great question. So let me go back to this really quickly just to review that. So here, the fluid that comes from the blood plasma in here that goes in the capsular space is called filtrate. But as soon as the filtrate goes into the proximal convoluted tubule, we call that tubular fluid. So try to think, okay, we're in a tubule, so it's tubular fluid. And it's still tubular fluid up to the point where I'm talking to right here. So that was a great question. Once we get to the minor calyx, or the papillary ducts that go into the minor calyx, now that tubular fluid is called urine, which is what we are all familiar with. So urine is when that liquid is officially called urine. It's once we get past the papillary duct into this minor calyx right here. So let me just pause just for a second and let me know if there are any other questions here. You guys are doing a great job following along, I think. And again, this video will be archived to my channel, so you can watch it anytime. Okay, so here from the minor calyx, okay, calyx is the singular version of the word calyces. So many calyxes is actually called calyces. So we have one minor calyx here. Here's another minor calyx. Here's another one. Basically, the minor calyces connect directly to the pyramids here. When those join up, so for instance, see how we have one minor calyx here and another minor calyx here? Where those join up, that is what we call a major calyx. So again, remember that in A&P, a lot of the terminology we use is very descriptive of what it looks like. So the minor calyces are going to be smaller tunnels. The major calyces are where we have more than one minor calyx meeting up, and it's a bigger tunnel. So minors are smaller tunnels, majors are bigger tunnels. And those major calyces will meet up into this portion called the renal pelvis. So this right here is the renal pelvis, and that renal pelvis is what connects to the tube exiting the kidney called the ureter. Okay, so I know that part is there's just a lot to that, but hopefully that gives you a better understanding of where blood and urine meets up. It all takes place in that renal corpuscle, that glomerulus, and then it will continue through the nephron. Things that need to stay in the blood get reabsorbed. Things that need to leave the body via urine get secreted to be added to that fluid there. Okay, Christy asked, what is the difference between the papilla of pyramid and calyces? So great question. Let me bring this model up here again. So the papilla of the pyramids, those are just, think of the papilla of the pyramid as the tips of the pyramid. Okay, so these portions right here, the papilla of the pyramids will meet up into a tunnel called the minor calyx. So we have two different kinds of calyces. The minors are the smaller ones. The majors are these bigger ones when you're going to have multiple minors meet up. So does that answer your question? You guys are asking great questions. I know there is just a lot. Okay, yep. And then Michelle said, so what is the name of the chamber after the majors? So bringing this back up, these big tunnels are called the major calyces. They meet up to this large room. If you want to think of it, these small hallways lead up to a large room called the renal pelvis. So the pelvis is what connects these little branches to the ureter. Okay, let me check more questions here. Okay, Morgan asked, if you only have one kidney, do you pee less or does it just take longer to fill your bladder? So that is a great question. I need to look up information on the specifics of that, but certainly if you're because each kidney is going to be filtering a portion of what we call your cardiac output, meaning the blood that your body is pumping out, it would only do half of what your body normally does. So let me, I'm actually gonna look that up, and what I'm probably gonna do is the questions that I wanna give a better answer to, I'll get that together, and then I can put the information in the comments. So that was an awesome question. Okay, very good. Okay, so let's now look at the bladder. So speaking of bladders, that was a great segue. to talk about the bladders. Here, going to this model, we have the ureters. So the ureters are those big tubes that are going to connect the kidneys to the urinary bladder. By the way, if you have a renal calculi or a kidney stone, that is what makes those so darn painful. I have heard, I've never had one. I hope I never have one. But yeah, those stones that are stuck in the kidney, you can get them in different parts of the kidney. But when people are really having pain in the kidney, and when I worked in the ER, it was like you could almost tell who had a kidney stone, because we call it the kidney stone dance, because you can't, it's just super painful. You can't get comfortable, very severe lumbar pain, kind of call it like loin to groin pain. And the reason why I have that pain is because that stone is like wedged in the ureter. When it starts making its way out of the kidney is when that's really, really painful. So again, those will go to the bladder. So let's take a closer look at the bladder. The bladder is kind of cool. Here I want to point out a couple of things. It's made up of, oh, well, we'll talk about the histology in just a minute. So I'll go over the layers of the bladder in just a minute. So here we have, these represent the ureters, and they will open up to the inside of the bladder. We have this triangular area of the bladder called the trigone, and the trigone is different from the rest of the bladder up here. These folds, okay, are something that my students have seen before. Do you guys remember what those folds are? We saw those in the stomach. They're called rugae. And why do we want folds anywhere in the body? Folds provide more what? Yes. So if you guys watched, I put a little video on my Instagram channel. Yeah, very good, Christina. Yeah, rugae, very good. So on my Instagram channel, I just posted in my Facebook page a video of me chugging, it was coffee. And yes, I actually really did have to go in that video. So the running was real. But we want to have, yes, very good. Jennifer said space to stretch. So essentially when we have rugae, same thing in the stomach, it allows that organ the flexibility to open up. And so when we are chugging water or coffee or whatever, it will allow our bladder to what is called distend. We also have this epithelium called transitional epithelium, meaning they're different. It's not just one specific shape of cell in there, and that's also to allow for the distension of the bladder. Here in the trigone though, so I'll hold this up here, this serves as a funnel into the next tube we have called the urethra. So the urethra here is this tunnel right here. It is the passageway that connects the urinary bladder to the external genitalia. So if based on whether we're looking at males or females, we will have different lengths of the urethra. In a female will have a much shorter urethra. A male will have a much longer urethra because the urethra runs the length of the penis, and we will be talking about that. Right? We have to talk about that? Yes, we have to talk about that when we go over the male reproductive system. And so questions I get, what is this thing here? Okay, does anyone know? First of all, we can tell based on the structures we see here, the anatomical structures, if this urinary bladder belongs to a male or female. So, maybe make a guess to yourself, maybe type it in if you want to put a guess out there. But this would belong to a male. And how do we know that? It's because this right here is the prostate gland. The prostate gland, which is only found in males, sits on the inferior surface of the bladder. This is something we're going to go over again in the male reproductive system. And we have these other structures here called seminal vesicles. These are reproductive structures, and so we'll talk about those more when we get to, yeah, very good, very good. We'll talk about these more when we get to the male reproductive system, but that is just one way when you're looking at a model. If you see this kind of walnut-shaped organ, that you are looking at a male bladder. Just a quick note, kind of a little bit into something we'll talk about in a couple weeks, but this is why when men have enlarged prostates, they have problems micturating or urinating. So micturation is the well, the A&P term for urinating. So you can see that a male's urethra, and it's actually called this region in a male is called the prostatic urethra. If a male has an enlarged prostate or it's inflamed, it will smush on that tube right there, and it really makes it hard for a man to urinate. So kind of a little bit of stuff that we'll return to again in a few weeks, but definitely related to this chapter here. So let me look at the comments real fast. Yes, I'm loving your comments. Yeah, dealing with lab and lectures make me miss being in a classroom. I totally get that. You guys can tell I'm in my AP1 room, and there's a big echo in here, and it's all lonely in here, but we'll just make the best of this. I love the technology so we can kind of virtually be together. Okay, so let's talk about the sphincter. So this is actually, if you go to my Instagram account, and it's just at The Anatomy Gal, or if you're on Facebook, I made a page called The Anatomy Gal. I actually wrote out an explanation talking about the sphincters. Now, if you're one of my students, I did a little demonstration that was very similar to this when we were talking about what happens when you need to do the number 2 stuff. And it's very similar. So we have an internal urethral sphincter and an external urethral sphincter. We don't have this. I can kind of show it on this model, the basics of it anyways. But our internal urethral sphincter, so remember, a sphincter is a circular muscle, and it will control the opening or closing of wherever it is in the body. We have our orbicularis oculi, orbicularis oris, those are sphincter muscles. What? We have sphincter, the cardiac sphincter of the stomach, the pyloric sphincter of the stomach. So anywhere we need to open or close something, we're going to have a sphincter muscle. So the internal urethral sphincter is located at the base of the urinary bladder. So it's going to be in this area right here. Whenever fluid comes in, okay, for me, it was most likely the gallon of coffee I had earlier that day, the bladder will distend, and that muscle, that sphincter, gets stimulated. And that is that feeling where you're just like, ooh, I really need to go to the bathroom. Okay, so then what allows you to hold it until you make it to the potty? Well, thank goodness, round of applause for our external urethral sphincters. It's not shown on this model, but it would be where my finger is. We have a structure called the urogenital diaphragm, which is a band of muscle, and that external urethral sphincter is located around the urethra in this area. Okay, so again, you can't see on the model, but I'm just kind of showing you where it is. I have an image on my Instagram post. If you just swipe over, you can see, I found an image online, and you can see it there. The internal urethral sphincter is made up of smooth muscle, so we cannot control that. Remember, thinking back to the basics of the different types of muscles in the nervous system, we cannot control smooth muscle. So that's why when you get the urge to go, you just got to go, right? You're like, okay, I need to find a bathroom. What allows us to hold it is when we contract the skeletal muscle within the external urethral sphincter. So remember, we can consciously control skeletal muscle. So that allows you to, cross your legs like this and hold it until you get there. So yeah, very good. So Christina, I did want to mention, yeah, this is figure 8-6 and 8-5 if you're one of my students in our lab manual. So that's what you can be looking at. When we are potty training our little ones, we are getting them to realize that they can consciously control their external urethral sphincter so that they can actually hold it until they make it to the potty. So that's kind of a cool thing to think about. What I talk about in the digestive system with my students is that whenever we would, if we're able to ask a patient directly, if it's a trauma victim or maybe a seizure, a trauma patient or someone who had seizures and they're coming in, we'll ask the question, did you poop or pee on yourself? And you might be thinking, that is a really embarrassing, disgusting question. But if we are assuming we don't have any issues, we're past the age of potty training, should we be able to control our urine and our feces? Yes. So if we cannot, okay, now we have to think, I should be able to control that. If I cannot, now what other body system, what other organ system should we be considering now? The nervous system, because we have nerves that run to those muscles there. So kind of take like a funny example or how I like to teach it in class, but then we can kind of tie it back to something a bit more serious and say, okay, this is why it's important for us to kind of learn the body systems, but then remember the things, the other systems it connects to. It's very integrative. Okay, so then that urethra is going to run the length of so if it's a female, much shorter urethra, a male, much longer urethra, and then the opening from the tube to the outside, okay, so to the external genitalia, that is the external urethral orifice. Orifice just means opening, so you could kind of think, okay, that's the opening where urine will eventually come out of. Okay, so let me check for questions here. Okay, Jennifer says, so do pets do the same when we train them to hold that? I'd have to look. I'm not as familiar, with like canine anatomy and their urinary anatomy. But I imagine, so I don't know if they have an internal or external setup just like we do. But again, that's another thing that I love it when you ask questions because I love to learn. I don't know everything there is to know about this, right? I'm trying to learn everything there is about this, but I love your questions because I can look that up and then pass on what I found out. So I'm going to look that up. And then again, in the comments of this video, I will post my findings. So thank you for that. And just in case I can't save these, let me just quickly, so pets, 1 kidney. That way I can go back and address those questions. Okay, very good. So do you guys have any questions on things we've gone over so far? Okay, please clarify on the urethral sphincter and the orifice. Okay, great question, Christy. So the sphincter is just going to describe the muscle that surrounds the urethra. So if I were to get this model right here, okay, remember this tube, this passageway right here is the urethra. And we will have 2 sphincters, one up here, and then it's not shown on this model, but the external would be down here. And those sphincters surround the tubes, and that's what we were just talking about. The orifice is going to be, so this tube is going to continue the length, the appropriate length for the person we're talking about. So if we're talking about a female, which I don't have a female, for a male, this will be much longer because this is actually going to run through the length of a man's penis, okay? So at the very end of the, where this tube opens up to the external environment, okay, within our genitalia, that is what the external urethral orifice is. Orifice just means opening. So that's the final opening before the urine, goes in the toilet. So did that clarify that question for you? The last thing I just want to, okay, so very quickly, so we have to identify these structures on the cat specimens. So for the cat specimens, so first of all, we do have pig kidneys, and my YouTube video, the main one that I have for this, if you aren't familiar with my channel, I created playlists, and the playlists are divided up by organs or body systems. So you can just go to playlist and then find the urinary system and see all the videos that I've uploaded to date. You know, I'm still trying to create more content, but everything that I have up to date is up there. And so, very good, Christy. So for the pig specimens, make sure you watch that video for that. There's a lot more on the pig kidneys than there are on the cats. I don't have a video on the cats right now, and I suppose I could take the time to make one, but just to, I feel like you guys would do fine on the cats if I didn't make a video, just because we've actually seen a lot of these terms before. So for my students, this is on page 135. So the things that you would have to know, just the right and left kidney, very straightforward. We actually had to know that for AP1. Remember, excuse me, for the renal hilus or hilum, that's just the indented portion. So if there's a pin or a probe on the indented portion, you know that that's just renal hilus. And then the renal artery and vein, we've seen those before when we went over blood vessels. So those would be straightforward. The ureters, just a tip for those is that the ureters are going to be, remember the ureters connect the kidneys to the bladder. And so those will be tiny little tubes. So when you're looking at an image of the cat, when you see a tiny little tube and it's connecting the kidney to the bladder, it can't be anything other than the ureter. And then you'll just have to say whether it's right or left. And then the urinary bladder is just that pouch-like structure. And then the urethra is the pathway from the bladder to the external genitalia. So I think you guys, I feel confident that if I don't have a video on the cat, that I think you guys will be okay because we have such a short list there. And those terms are a lot of those are things we've seen before. Okay, so hopefully that answers that question. So then the last thing I want to go over is the histology. Just basics about the histology. So the first thing I want you guys to know is, can you identify the fact that you're looking at the urinary bladder? So for my students here, okay, this is, and actually, can you guys tell me really quickly, just because I don't know, is the text backwards for you or is the text normal for you? If you could tell me in the comments that way, because it on my view, it is mirrored, it's backwards. And if I'm pointing stuff out, I want to make sure. Okay, good. All right, so, okay, quick question before I go into this. Christina, okay, thank you, Alexa, for that. Christina, do you know if we've asked about, say, nephron versus loop of Henle? So just for quiz purposes, make sure that you're paying attention to where the arrows are. Remember, I'm going back and I'm reviewing the answers you type in. So if, for instance, you got marked wrong because, we're kind of dealing with the formats of our online quizzes right now. If you said loop of Henle and the answer was supposed to be nephron loop, and it counted you wrong, I would go back and give you credit for that. And then if it's a specific part, there should be an arrow or brackets or something, meaning if it's the loop of Henle and how do you know if we want descending or ascending, the question should also say, name this specific portion of the loop. So I hope that answers your question, Christina. But again, when I go through, which will likely be, again, for my students, not until Saturday or Sunday is when I'm going to go through and review all of those. That's kind of how it's going to work best with my own personal schedule with doing all these things here. Okay, so quickly regarding the histology, so I'll just kind of give you some big picture points about this. Remember that we have 4 layers. Now, we do not see the adventitia here because it's more external than what we've shown on this view. So just know that there is an adventitia, but it's not shown here. We have the mucosa, the submucosa, the muscularis, and then the adventitia. So the mucosa, and maybe I'll try to, let me actually mark my lab manual and then I'll show it to the screen so you can see it. The mucosa is made up of those two areas right there, that dark brown and then the pink. The dark brown represents the transitional epithelium. Okay, remember the transitional epithelium is what allows the bladder to be able to distend and change shape. And then we have what is shown in pink, that is the lamina propria. It's made up of a dense, irregular connective tissue. You don't really have to know that, I guess, but just know that that is the lamina propria. But we see that pattern. We see a lot that an epithelial tissue attaches to the lamina propria. So that pattern is what we see repeated over and over again. And then this area right here, let me use a different color. This lighter area, which I have in orange, that is going to be the submucosa. So we kind of think beneath, it's beneath the mucosa. So again, dark brown is going to be the transitional epithelium. The pink is the lamina propria. Both of those make up the mucosa. And then what I have right here, this lighter part, that is the submucosa. And then here, all of this is that the smooth muscle layers. We have an inner longitudinal layer and then an outer circular layer, but we don't have you differentiate those in your lab manual. Let's see here. One thing I want to show, so on the next page, okay, you can kind of just see the from macroscopic to microscopic. Okay, again here, this dark brown, that's the cortex. The lighter color is the medulla. That includes the pyramids. But for this, you know, we talk about that quite a bit on these models where they're seen better. So make sure you know it on the models. And then the collecting ducts. So here we're zoomed in, low power, longitudinal section, medullary pyramid. So that's the tip of the pyramid. And remember, the reason why the pyramids look stripy is because we have all these collecting ducts. And that's what those white areas are right there. Over here, we have the collecting ducts, and which are made of simple cuboidal epithelium. You guys can see that there. That's actually a reminder of stuff we talked about in A&P 1. So you have that there. And then the loops are going to be the smaller portions, the smaller areas right there. Okay, on the next page, just some things I want to point out. On figure 8-13, so this one right here. Remember that the renal, so I'll start with this one right here. Remember that the renal corpuscle is this entire structure right here. It's made up of the capsule and the glomerulus. So the renal corpuscle is this outer portion right here. The glomerulus is that ball of capillaries on the inside. This white portion right here, that's your capsular space. Okay, so that portion in between is the capsular space. And then the parietal layer of Bowman's capsule, that's just this outer layer. Remember the visceral layer, which is not listed here, but the visceral layer is just the surface, those podocytes on the surface of the glomerulus. What is the tube that directly exits the renal corpuscle? That is the proximal convoluted tubule. So you'll notice we kind of have these like finger-like extensions within that tube. It kind of makes the PCT, proximal convoluted tubule, look fuzzy when you look at a photomicrograph. So that means when you're looking at these cross sections, remember a cross section is when we go just like that and we're looking at a circular shape. Yep, very good, Chrissy. Yep, that is the proximal. So here, because you see those little finger-like projections, you know you're looking at a cross section of the proximal convoluted tubule. If it is smooth, okay, like this one, you know you're looking at the distal convoluted tubule. Okay, and then over here, all you need to know is that these structures right here are the renal corpuscles. How do you know it's a renal corpuscle? Because you can see the glomerulus on the inside. Okay, so that kind of is a brief or review session of lab exercise 8. Do you guys have any other questions or comments about the sessions? I think that's how I'm going to do these Friday YouTube live sessions. I'll pretty much start from the beginning of the exercise and I'll work through what we have. I'll kind of pause during each section we have, address any questions you have, but certainly, especially if you're watching this after the fact, at any time, if you have any questions, you know, just send me a message on Canvas. I'm doing my very best to address all of those questions every day. But if I don't get to your question that day, then certainly the next day I'm making it a point to answer those questions for you. So you can do that. You can always send me pictures of your lab manual and ask me if you labeled things correctly. I'm more than happy to do that, especially during these times when you can't ask the questions like you normally would in class. So just please know that I'm here for you during this time. We're gonna do everything we can to help you guys finish successfully. I know this is not ideal, but we're just gonna do the best we can, okay? So just always let me know how I can help you in that regard, and we will get through this. So if you'd like, you can leave a comment. Let me know how this session was, if it was helpful, if you have any suggestions, or you can send me a message on Canvas. This time is for you, okay? So I have an idea of how that works, but I'm hoping it matches up with what your expectations are and what you actually need. So if I'm not doing something in a way that's actually helping you, please let me know, because otherwise this is a big waste of time, right? And we don't have time to waste time right now. So anyways, with that said, I hope you guys are taking care of yourselves. I'm glad we're able to use technology to get together in this format, and let me know how you guys are doing. So very good. Love the comments. Yes. Oh, you're so welcome. Yes. And I miss seeing you guys. I miss seeing your faces, and you know, now it's just going to be 10 times more awkward when I crack jokes because there's no one here to laugh. And I'm just really hoping you're laughing at home, even if it's at me. Okay, all right, so take care, guys, and I'll see you next time.